Duane, I really appreciate you getting together with me today. I was hoping that we could just talk a little bit more about some background on Hendrick and the relationship with Parlance, and really the story behind how we got here together and how it's working for Hendrick.
Yeah, basically, my name is Duane Donaway. I'm the Director of Technology at Hendrick Health System, and we're a nonprofit healthcare provider in Abilene, Texas. We're standalone. We're very technology driven. We've stage 7 MRAM from HIMSS. We're a most wired hospital. We're of a 5-star rating from CMS. So technology and is a big part of what we do.
And talk to me a little bit about the decision to work with Parlance.
Sure. Our goal was to is improve the patient's experience when they're calling in the Hendrick system. We wanted a fast and simple voice-enabled call routing solution without the large cumbersome phone trees where you press 1, 2, 3, 4, whatever, as well as a solution that would connect to any phone just by speaking the name of the person, patient, or department they wish to reach. And the Parlance phone system helped reduce the time and effort required to contact other employees or departments.
Do you feel like the consensus within internally was a positive one? I know that you folks did a great job marketing Parlance with the system so that people knew internally what was to be expected.
It was a great experience with them. Like I said, we were implementing this during the COVID time, so our staff was busy doing other things, and so Parlance did a great job at helping us be very proactive with the implementation, especially, like you said, a reduction of these large phone tree systems.
Yeah, I think that it's interesting that you mentioned the COVID, because I know that is something that most of our customers had to re-record the voice prompts at their main number. And was that something that was a little bit comforting, that was one less thing that you had to worry about?
No, that is true, because that was one thing we made the one call, and then Parlance was able to make the changes and that we needed to make onto it.
Duane, what do you feel like the experience with Parlance has been, just in terms of, you've got a lot of different vendors that you're working with, and how you would really describe the culture at Parlance and the partnership?
They've been very, very willing to to work, make adjustments. Like you said, during the COVID times, we were tied up and would get canceled and move off to other things. And like I said, they're very patient, worked with us on getting this up and running. The one thing another thing that we liked about the Parlance system is if you called looking for a department or a name, when you call the telephone operator, you might get a different phone number, or this, that, and the other. With the Parlance system, you always get that same number, and you get rid of all the transferring the person around different calls.
I have to tell you, Duane, everyone at Parlance has loved working with Hendrick Health, and your colleagues have all been wonderful. And I think that was one of the reasons why things went so smoothly, because from the beginning, we had a set Monday call that happened every single week, and everybody was doing their piece. So it really made for a very easy implementation. And one of the questions I get asked a lot, and you can probably answer this, is from a technology standpoint, in terms of the easy or heavy lifting that's required to get Parlance up and running. How would you feel about that?
No, it was very easy. One of the things is you've got to, make the modifications onto your phone system, and then plus get the ADT feed of the patients, what their names are and their room numbers. Another thing that Parlance does that helps us out is they listen to the phone calls to make sure that, the missed dials and is all programmed the way that it needs to be.
You were really a model customer from our perspective, because you started with the main number of the hospital, and then after you got that up and running, you moved over, and I believe you put an HR application up, as well as contact center application.
Call center, yes, yes, and that was one of the things is you put these call centers, phone numbers trees up, and it has so many, places that it goes off to, and it's always being changed, and you never know if it's correct or not. And now with the system we've got now, you just speak where you want it to go to, and it'll transfer you to the proper person.
Yeah, that's interesting that you mentioned that, Duane, because I do talk with a lot of people that have the phone trees, and they say when I want to make a change to it, it's a big hassle and it's expensive. Anything else that you want to add? How much you enjoy working with us?
I love working with you guys. Yes, we do.
Thanks so much, Duane.
Thank you.